Welcome to This Week in Hearing. Hello, I'm Bob Traynor, your host for this episode, and it's a real exciting one because it was cooked up by audiology colleagues in a van on the way back from Tijuana to San Diego and so on. We're going to title this talk Clinic to Corporate, Discussing the Transition. And many of you may have had the opportunity to work with corporate audiology, and these can be maybe some helpful insights into this transition for you. This is a major decision made by many audiologists to work for companies that supply products to the hearing impaired or help us with equipment and other products that work with the assessment or rehabilitation of the hearing impaired. Today, my guests are Sheena Oliver, Chief Marketing Officer and U.S. Head of Marketing for the Americas at WS Audiology. Alan Raffoff, VP of Marketing for Widex. Leanne Earl Powers, Senior Director, Professional Education at WS Audiology. Shanika Adams, Senior Director, Professional Development at Hear USA, and Gabriel Gatto, Regional Sales Director for Signia. And thank you so much for being with us today, guys. It took quite a lot of orientation to get all these very, very busy people together for this particular discussion. So thanks again for being here. So let's start discussing some of these things. And here's an assignment to everyone. Can we kind of go around the horn here and just talk a little bit about your journey from audiology clinic to the corporate world? I will start with Alan and see what his journey was.
Hi, Robert. Yes. I think when I think about it, 20 years ago, and when I made the jump, I'd say I did it by accident. I was working in a really busy private clinic. I was doing a lot of hearing aid fittings and clinical testing. And then a change in my life led to a relocation. And so I moved from the Philadelphia area into New Jersey. And at the time, I needed to find a different place to work. I was looking for something local to where we were relocating to. And I stumbled across an opening at a manufacturer. And so it was one of those things where whether it was karmatic or divine intervention or just dumb luck, I don't know. But I ended up getting a position as a support audiologist. So it wasn't a big jump from what I was doing in clinic. I was still working just one step removed from the patient, but supporting fittings. I ended up really enjoying the environment, really enjoying the work, really enjoying the camaraderie of the office, and 25 years later, here I am.
Wow. And not an unusual story, Alan. Shanika, what would be your story in your transition?
Sure, thank you. So I started my career with Hear USA immediately after my externship. And I was, again, as Alan mentioned, I was a provider, a dispensing audiologist at one of our hearing centers. And actually from there, made a leap to become a part of the local leadership team. So I was a trainer, and all this was actually in Southern California. So I was a trainer for our hearing care providers and then became what we call then an area manager where I managed centers. And then I actually ended up moving back to the Northeast, which is where I'm from, to become what we call a division manager. And I managed several states and our hearing centers there. And over time, through actually a restructuring, I had the opportunity to take on a role at our corporate office or support center. And that's actually how I became a corporate employee through various transitions over time within Hear USA.
Wow. Okay, Sheena, tell me about your transition, and we'll see how that compares to some of the others as we move forward here.
Sure. Again, thank you for having us, and probably very similar to the others. I worked several years clinically and really focused on hearing aids and oral rehab. I loved it, knew I wanted to do hearing aids forever. And I remember just being at a training, and I saw the sales reps and the trainers, and I was like, you know what? I could totally do that job. And not long after that, I started working as a sales rep for a hearing aid company. And then eventually I joined the corporate office, working in project management, product management, sales, and finally marketing to where I am today.
Wow. Gabe, tell us your story.
Yes, thank you for having me. My story is pretty similar, I would say, to everybody else's. I was in the clinic for probably 12 years before I decided to cross the bridge to the other side, to corporate. But I worked for an ENT's office for many years and then decided to even open a practice myself and did that for about 3 years. And just as life changes, so did my career goals. And I ended up at Siemens at the time as a trainer, and then have probably had almost every job in that company since. So 16 years later, I'm blessed to be where I am, but that's kind of what led me to where I am today in sales. But we're all basically doing the same thing, whether we're doing it clinically or whether we're doing it for corporate. We're still helping people hear better and changing lives every day. So it's just a different version of what I started 27 years ago now.
Jeez. Wow. Well, it doesn't make any difference if we're doing it on the hearing aid side, if we're doing it on the equipment side, or even in some of the conceptual sides that are on the corporate side. It all is working with the hearing impaired and other disorders that go along with hearing loss. Leanne, can you tell us a little about your transition and how you ended up as one of the main training people for Signia?
Yeah, well, I think that my transition story will kind of explain where I've ended up as far as what I like in my position and the position I have now. So I was a clinical audiologist for over 16 years. And I did a lot of work in hospitals and spent a fair amount of time in an ENT office as well. Like Gabe, struck out into the private practice world for a little while there. And it was there that I learned that I really liked a training aspect, because we started to hold at my office lunch and learns. And at first we would ask for help from from training support from different manufacturers. But, it was very quickly that I realized that I could do that. And I feel very comfortable teaching. I feel very comfortable talking about hearing and what is important in starting your journey to better hearing. And so quickly started to do those lunch and learns on my own and found that I really, really love that aspect. So it's kind of a natural transition then into a training position with a manufacturer where you can take that educational teaching and to a new level.
It's just a different way. You're actually basically a professor of Signia currently, and those kinds of things instead of a professor of audiology at Armpit State or something like that. So this is fabulous, and thank you guys for your orientation and discussing your transition. So Sheena, what was the biggest challenge that you had going from clinic to corporate?
Well, there were many, but I would say the biggest one was probably just being able to keep a pulse on reality. I think, once you kind of get in the ivory tower, it's easy to forget what's happening in the real world with real hearing care professionals and their patients. And so I think, the biggest opportunity, the biggest challenge was just how do you keep that connection when you're working in corporate to make sure that the things that we're working on, the things that we're developing are actually going to add value to the people that we're actually creating them for. So I'd say that's probably the biggest thing.
So Shanika, what was your biggest challenge?
Gosh, when I thought about this, I really feel like my biggest challenge was going from working in the business, because I'd worked in the business for so long, either as a provider of hearing care or managing providers and hearing centers, to really working on the business and really determining or understanding myself how that still impacts hearing care. When you're working in the business and you're making decisions every day, although you have long-term goals, right? You're looking at, okay, how do I help people hear better today and this month? Or how does my team do that? Whereas when you're working on the business, in order to support those people in those hearing centers, you got to kind of reshape that to how do I help the teams and have a greater impact? So that was the biggest challenge or really opportunity for me in making the transition.
Yeah. They don't teach you that stuff in school, do they?
Not at all.
and one of the things that I've seen as a former academic program director and as a professorial individual is that there is a lack of real world interaction within the academic community. Once they get there, they're probably okay for the first 3 years or so, but after that time, boy, things change a lot, particularly in the hearing aid world, in assessments and a lot of things. And so what I enjoyed about my time was the contact with the real world and the real people that are actually interacting with the patients all day, every day. So, Gabe, what do you miss? So what do you miss about the conducting of evaluations and seeing patients routinely in the clinic?
I would say the biggest thing that I missed is the instant gratification of seeing the look on those patients' faces when you put those hearing aids on their ears, and the communication that you start to see between them and the people that they love and that love them. So I wouldn't say it's necessarily missing anything, because I do at a different level get to see the same amount of joy, but it's a little farther down the road. So I would say it's just the instant just look on their face and the brightness in their eyes, and just getting to see them engage again when they had stopped for so long.
What about you, Leanne? Do you miss any of this clinical interaction? My guess is you probably see some of that with the training programs, right?
We do. As a trainer, you still get time to go into offices and help people and do fitting assists. And so you get a little bit of that patient interaction, which is so valuable. But what you miss is that long-term connection to some of your patients. We had, patients that we saw through several generations of hearing aids. We have patients that, brought in a family member, and you get that real connection with the family. I think when you're working with them in the clinic that way.
Cool. So have you thought about going back to the clinical area, Gabe, at all?
It's never crossed my mind even one time.
How about you, Shanika?
You know what? I have thought to myself, okay, I never say never. I always say Shanika, never say never. And so what I've thought about is that if I went back into the clinic, it might be more contemplate like as an owner, right? So that I could take everything that I have learned and that I've seen from others and implement it into a clinic. And that's really what I thought about if I were to take that step. But again, it would probably be a big leap for me, but that's where I would see it landing.
Okay. Now, Sheena, have you ever thought about going back?
I'm right there with Gabe. I mean, there's something to be said, and I don't want to say like we have pure 9 to 5s, because we certainly all work outside of 9 to 5 hours, but definitely not having the added responsibility of if you're owning your own practice and all of the things that come with that, and being, solely responsible for the people that work for you financially, and knowing that, you're responsible for their livelihood. So from that perspective, probably not. But like Shanika, never say never.
Well, there's always that person who says, sorry, I can't come to work tomorrow. My mother's sick. Or the patient that calls up at 7:30 at night says, my hearing aid just quit working. Can you come over and fix it? That kind of stuff. So, exactly. So honestly, those are hardcore private practice problems that people deal with that are in practice each day. And most of you guys appreciate that for sure. So what's the coolest thing about your position in the corporate world, Alan?
Yeah, for me, that's an easy one to answer. And I think I wouldn't, I think I would frame it a little bit in the coolest thing that the experience of working on the corporate side for the last 20 years has brought me. And that's just the exposure to the different people, different cultures, and being able to see other places. And, I simply would not have had the opportunities to go to the places I've been, and to meet the people that I've got to meet if I didn't make this trip. So, or this journey, I should say, whether it's a trade show, whether it's a launch event, and I was fortunate enough to be in a situation where for one of my former employees, I lived overseas for several years, and all those things, like, it changes you. It broadens your horizons. I think, the more people you meet and the more diverse situations you put yourself in, the better person you become internally. And for me, flat out 100%, that an irreplaceable part of my career and something I'm super, super thankful for as being on the corporate side of the fence.
So Sheena, as kind of a major marketing person in the company, how do you see the coolest thing about your position?
It's interesting. It's identical to Alan's. I think, just the amount of travel that I've been able to do over the years, I'm certain I would not have done that otherwise. Just being all over Europe, Asia, South America, of course, North America. And I think the thing that's been the most cool, if you will, is just being able to see both the differences and the similarities of how hearing care is provided across the world. It's just fascinating. And, every time you go to a different location or a different country or a different region of the world, you can take pieces of that and bring it back. So for me, I think that's just been the coolest thing ever.
Cool. Leanne, would you have some comments in that area as well?
I will. I think I definitely agree with Alan and Sheena and the experiences you get. But I would add to that, being in the corporate world, the technology that we get first exposure to and get to really dive into at a different level than you're able to do sometimes at a clinic. I absolutely love where hearing aid technology has gone, the advances that we've made in so many different ways. And I love being on the forefront of that and then learning what are the benefits of that technology for your patients and helping to wrap that into a package that we can deliver that people understand and that resonates with the end users.
Well, and then also my guess is that you are really involved in the digestion of those technologies into how it's presented to your to the clinicians and that kind of thing. So everybody seems to understand it, from the ones with, and we won't say much, but there's some that have minimal orientation to the field, and others that have super orientation to the field. That is definitely something that you have to think about when you're doing training. One of the things that I found in my experience was that I learned, as Alan said, so much about cultures and so much about how the profession is practiced in various places. Now, in my generation of what we were doing, every time I went somewhere, we always talked about audiology and methods and so on as well. And I know all of you do the same thing. And we work then kind of as ambassadors to markets that are not quite as developed as ours. And I've had the opportunity to, and you have too, I'm sure, the people that come here to study, they end up with PhDs. They go back to their universities and they train colleagues within their own countries, which a lot of us are seeing now as, well, customers or as individuals that are working with patients that are just like our patients, only they're from a different culture. So it's fabulous to see that you guys have that orientation and are kind of taking over where a lot of us have decided to move on to do things like This Week in Hearing. Corporate positions sometimes, not sometimes, I'd say virtually always, require a lot of travel. And how did you adjust this between you, and not just you, but your family as well? Because we all have families and we all have kids and we all have this and that. Maybe have some missed soccer games and some missed fabulous things that have happened in the family and that kind of thing. So Sheena, how did you adjust to that?
It's interesting. I started traveling before I was married and had children. I did have a cat. So it was much easier to do that then than if I were to think about that now. So for us, for our family, it's just part of our routine. My family, they don't know anything different because we've always done it that way. But I do think it's important to point out that that type of travel does come with a cost, right? I'm not the primary parent at home, which means I'm typically not in charge. And, my husband often reminds me, like, I need to play my position when I'm home and not disrupt the household dynamics. And so most of the time I'm okay with that. But I think it's important to note that if you are someone who feels like, you need to be in charge all the time or in control of everything, even when you're not there, this is probably not the type of role that you want for your family, because I just think it would be too challenging from that perspective. You have to be able to let go and let other people lead.
So, Alan, how did you and your family handle that situation?
Yeah, there's two things that I think about, to make this kind of career and lifestyle work. And the one, I mean, maybe it's stating the obvious, but you got to plan. You hit the nail on the head. There's things that are coming up. There's soccer games. There's hockey games. There's birthdays, and you have to make sure that everything is planned ahead. So you're making the correct choices on when to say yes and when to say no, and when you don't have a choice, that you're making the right adjustments, corrections, whatever, to make that work. The other thing, which I firmly believe in, is that you have to embrace it and you have to enjoy it. You have to make a choice to enjoy it, and so there's little ways you can do that. I mean, it's really easy if you're spending the weekend in a warm area, but let's just say it's a typical trip. There's still ways to find. Every city has something special. You might be able. I try to get up early and jog outside where we're at. If there's a river or a bridge to run across, I try to incorporate that into the plan. And the thing is, you're traveling so much, you have to find. It's for me, it's just important to embrace the fun side of that. Otherwise, it can become a drag, and then you're headed down the wrong path. So I love it. I think it's a great part of the job, and planning and embracing it is really what's made it successful for me to adjust to that type of lifestyle.
Now, again, as the director of training, there would be quite a lot of travel routinely, where you may only be home on the weekends if you're lucky. So how did that work with you and your family, Leanne?
So interestingly, I grew up where my father was in sales and traveled a lot. So I grew up with someone in my family that had a traveling job. So I think I was less concerned with it going in, but very quickly found out, like Alan, that you have to plan so that you make sure that you're home for the important things. You need to make sure that your family also is aware of where you are. And it's the same way that people with larger families have to plan out all of their activities for their children. You just work your schedule right in with that. And I think it worked out very well. I am grateful for getting to see so many parts of the US that I never would have seen without a traveling position like this. People in Europe, they travel. A lot of times the younger people will travel Europe and visit all sorts of areas. And we don't do that as much in the US. And I think that's a little sad, because it's so amazing to go from New Mexico one week to Pittsburgh, Pennsylvania the next week, and the geography changes and the people changes, the atmosphere, and it is an exciting part of the job for sure.
It's kind of like a big adventure. Oh, I have a trip to here. Oh, I have a trip to there. But as Alan says, it may be really cool to do that in Orlando in January. But when you go to Minneapolis at 50 below zero, it might not be so cool. So you kind of have to take the good, the bad, and the ugly sometimes as well.
Then you go to the mall in Minneapolis in January.
So does your corporate position give you some unique perceptions of audiology as a profession? How have you seen that, Gabe?
I think the biggest part of that is watching how everybody practices so differently, how they embrace their own structure within their own clinics. Even like they had mentioned earlier, Leanne and Alan, geographically, the differences across the country and how people see their patients, what their practices look like. It's always a new adventure to me when you get to walk into somebody's practice. I've seen everything from shag carpeting on the floor and people smoking a cigar sitting at their desk to the most pristine medical model of a private practice and everything in between. So I think that just seeing the differences and the variety and the passion, though, at the end of the day that we all have for what we do has really been the biggest part of that for me.
Great. Shanika, have you changed any perceptions about audiology as a profession and so on based on your position at Hear USA?
I wouldn't say I haven't changed my perception of audiology. As a profession, we get in our profession to help people hear better. But what has changed in terms of my perception from being in the clinic to being in my current role is really everything that goes into it. When you have that seat in the chair, you know what you're supposed to do to help people hear better. But it's about how do we, increase and expand access to hearing care, right? And you may not think of that as a clinician, where you think of that in a corporate environment. What are the perceptions, right? How do we help our teams hear better, or help our teams help people hear better, rather? And just really understanding all that goes into that, and the importance of our role as audiologists at that table with our business peers, and our other peers, our marketing peers, and that we can have a great impact on that.
Well, to me, it's kind of like a big adventure, and when you're working with individuals each and every day, you see the high clinics, you see the low clinics, you see the even lower than low clinics sometimes, the shag carpet with the couch and the newspapers everywhere, the guy with ring around the collar, all that stuff, all the way to those pristine places that look like they just walked out of something like some futuristic movie. So now I'd like to have each of you kind of give me an idea of some advice that you might have for colleagues that are considering this transition, which it's a big one. From what I can tell from my experience and what I hear from you colleagues, is that it's an adventure. It's almost a experiential MBA program, really, in many respects. And so I found that I learned much more about the profession by having exposure to all these different interactions with various people from around the country and around the world, and so on. So Alan, do you have some advice for individuals that are considering this transition into the corporate world?
I do. I think the first thing I would tell them is, as you could tell just from talking to this group, pretty much everyone who's on the corporate side of this profession is super willing to give you insight on their experiences. So I think that's probably the easiest thing you can do, whether it's Facebook, whether it's LinkedIn, any of the other social platforms, you'll know someone in a similar role that you're interested in. And I can guarantee that person will give you, a complete download of what it's like for them. And then the last piece of advice I would say just go for it. It's been such a positive experience for me. And it's like, it's like Bon Jovi says, you can always go home. You can try something and go back to what you're doing. Chances are a little jersey slipping out there, but you can always, you'll take that experience and you'll be better as a clinician going back to that. So I would highly encourage them to talk to someone, and I would highly encourage them to give it a shot.
And the idea of being able to go home, that's only been about the last, 20 years, you think, Sheena, something like that? Because prior to that, you couldn't always go home. But now that you can bring all that fabulous experience from all these different places and all these technologies and throw them right into a clinic, which would just be even a progressive kind of a way to go in and maybe out of corporate. So Sheena, what would be your advice to people considering this transition?
100% agree with Alan's comments. I think the other thing is just to recognize that there are so many different ways in which you can work within corporate as an audiologist. I mean, you just heard a sampling of the people that are on the podcast today. But I think it's important to recognize that like your first position may not be your dream position, right? And so, just see it as a journey that, appreciate the roles along the way, collecting experience, getting to meet people, making, connections until you reach that dream job, whatever it is, whether it's in marketing, sales, training, whatever the case may be.
Okay. Shanika?
And what I'd add to that is, something that Sheena just said, your first position may not be your dream position, but really, as you start to think about that transition, think about what it is that you kind of enjoy, right? And seek out people that are doing that. And then one thing that I think can be helpful if you're working for a company that has maybe multiple locations or works on different projects and initiatives is, to say yes, be a part of different initiatives, things that are occurring in pilots, because then you get to interact with, someone that maybe leading that initiative that maybe you want to be in a role similar to them in the future, and it gives you different experience and lets people your colleagues see you in a different light as well.
Well, and I would also encourage our colleagues that are watching the podcast to look at some of our another series that we do here at This Week in Hearing called Giants in Audiology. As Shanika and Sheena and Alan so far have indicated, nobody starts at the top. And that includes all these people that have had absolutely very, very complete, successful careers in the profession. A lot of them started kind of at the rock bottom. And when you go from clinic, where you may be kind of the pretty good person in the clinic that knows all this stuff, even the ENTs might like you some days, and some days not. But the deal is that you're going to start likely more at the bottom and start working your way up. And it's the talent and and your capabilities that will get you to the right spot. What advice would you have for young people considering the transition, Gabe?
I would say, just building off of my three colleagues before said, and they took the words right out of my mouth, because I've had, I think, 7 positions, 12 different managers. I've really kind of got the joy of experiencing everything that manufacturing has to offer. But I would say be nimble. As one of my esteemed colleagues has always said, it's knees bent, because the only constant around here is change. And so you kind of have to change with the industry, and maybe some of the preconceived notions that you had coming into all of this don't necessarily pan out the way that you had expected. But as Sheena mentioned, there's so many different opportunities within manufacturing that as you go through your journey, whatever that looks like for every person, you may stay in that same role for the whole time you're in manufacturing. Or like me, you may find the next best thing that you're good at and move into that. But just know that you're building on your experiences and you're getting better and honing that craft. And I would also say one misconception that I had is I finally got to work for one manufacturer so I could focus on what that manufacturer had, and I can become a real expert at that. But the reality of it is it doesn't let me off the hook as an audiologist to do my due diligence in knowing what everybody has to offer out there. So keep your ears perked and do your research, do your homework, be educated, and spread the news about what everybody else has and how we compare and why we are better.
Fabulous. Now let's I kind of saved the best for last. So Professor Powers, how would you see this transition, and what advice would you give to colleagues that are considering the transition itself?
I think all the questions that you've asked so far kind of lead up to this. One is, to consider that it is a change for you and your family. So, I mean, that those discussions should be had, but I wouldn't be afraid to take that leap. As everybody said, you can go back these days. We've had several colleagues go back and take with them valuable knowledge to owning their own private practice and being very successful with things that they learned from spending some time on the manufacturing side. I think it's very rewarding. opens you up to all sorts of new experiences, broadens your horizons, your thoughts, and you will go back to clinic. If you do go back to clinic, you'll go back with more than you had before to offer your patients, I think, in most instances. So I wouldn't be afraid to step into this world. I think it is a great world. And honestly, as an audiologist, I always think of myself first as an audiologist and second as the director of our professional education program. And I think even for hearing care professionals of all sorts, whether you're a licensed dispenser or an audiologist, that knowledge is with you always. And that becomes part of you. It becomes part of your identity, regardless of who you work for, where you work, or in what type of, where your position has transitioned into.
Fabulous. So today, my guests have been Sheena Oliver, Chief Marketing Officer, U.S. and Head of Marketing in the Americas for WS Audiology. Alan Raffoff, Vice President of Marketing for Widex. Leanne, I think we would call her the Professor Powers, Senior Director, Professional Education for WS Audiology. And Janikra Adams, Senior Director, Professional Development for Here USA, and Gabriel Gatto, Regional Sales Director for Signia. And we here at This Week in Hearing really appreciate your time, energy, and effort that went into this particular session, because I think it's a transition that many people contemplate, but they always have trouble. Oh, do I want to be in the manufacturing area? Do I want to do this? Do I want to do that? I think it's less of a challenge now than it used to be, but it is a significant one, and one that, as you guys have suggested, can be fabulous in terms of experiences, learning about cultures, learning about the way other people do practice the profession, as well as a tremendous adventure. So again, thanks so much for being with us today at This Week in Hearing.